Hello everyone. Good morning, good afternoon, good evening, depending on your time you are watching this video all over. My name is Blessing Chideberugu, and by the special grace of God, I'll be making this video to help you understand how to study anatomy. If you're a nurse, if you're a midwife, I've had a lot of stories, and I've also seen students fail their anatomy exams. I've worked in the education sector, and by God's grace, as one of an exam officer, after compiling and collation of results, I've seen students fail anatomy, and these have made many of them to even repeat classes. And when I see this, it usually pains me. And after asking some series of questions from some of them, and I find out that some of them, it's not just about fear, but sometimes they'll tell you that this is so big, I don't know how to read and prepare for my exams. And this has made me to make this video to help you. If you're a nurse, if you're a midwife, please, I want you to listen, watch through. You can get your writing materials and make sure to jot out something that will help you to pass your anatomy very well and to prepare for your examination and come out with distinctions. It's possible. People have been having it, and I want you to have it. So I want you to listen as we dive into this topic. So the topic I have today is effective study of anatomy for nursing and midwifery students. And I'll be using anatomy of the pelvic bone as a case study in this video. So let's go on. So what are my core teaching principles? One is that as a nurse, as a midwife, you do not need to memorize anatomy. What you just need is to understand it and visualize it. That's one of the secrets to pass anatomy in your exams. This fundamental principle will help you, effectively learn anatomy. Rather than memorizing the terms, it's better you focus on understanding them, understanding the structure of that anatomy, and also the functions. Are you getting me? Another thing is visualization is key. What do I mean by visualization? I want you to have a picture whenever you are studying it. Do you have a picture, maybe an abstract or a model with you, because this will help you to understand it well and not just memorizing it. Are you getting me? So visualizing is key. When you can picture a structure in your mind, you have to understand its purpose, and then you now connect it to clinical practice. So this knowledge becomes lasting and applicable. So this approach will transform anatomy from a burden of facts into a meaningful foundation for nursing and midwifery practice. So let's go on. So moving over to my introduction, I have here that anatomy is the foundation of nursing and midwifery practice. It enables understanding of body structure, disease process, clinical procedures, and patient care. Many students struggle with anatomy due to an over-reliance on memorization rather than comprehension. Just like what I said, anatomy is the foundation both for a nurse, a midwife, even medicine, any science subjects, because for you to understand this anatomy, you have to understand the body structure. It will help you to understand disease process. It will help you to understand clinical procedures and even how to care for patients. So it's a must that you must know about this anatomy very well. But students find it difficult, and one of the things that makes them to read and forget and not do well is what? When they just try to memorize, they want to cram some of the terms, which is not usually helpful. So this lesson will help students to understand effectively and understand rather than memorize, and they will be able to apply anatomical knowledge clinically. So today we are going to use the pelvic bone as our case study for you to understand this anatomy very well, because pelvic bone, if you're a midwife, it also helps, and also in nursing practice too. So let's go on. So what's our learning objective? First, we have to define what is anatomy and its importance. And that's what the first thing you're going to know. I want you to understand what anatomy means as a branch of medical science and recognize its critical role as the foundation of nursing and midwifery practice, enabling safe patient care and clinical decision making. Then secondary, we are going to explain functions and clinical relevance of these anatomical parts. We are going to explain the key functions of the pelvic, including the weight support, the organ protection, and its role as a passageway during childbirth, and then discuss some clinical importance in obstetric procedures. And like I said, we're using the pelvic bone as our case study. We're going to know the parts, different parts of the pelvic bone, including the ilium, the ischium, and the pubis. After that, we're going to talk about how to effectively study. The method you're going to use to study your anatomy is very important. From here, you're going to develop and apply effective study strategies for anatomy learning, including visualization techniques, breaking down complex structures, and preparing for examination successfully. So let's continue. So coming to definition of anatomy. Anatomy is the branch of medical science that studies the structure of the body and the relationship between its parts. It forms the essential foundation for understanding how the human body is organized and how its systems interconnect. That's very important. And this knowledge of anatomy serves as the basis for physiology, pathology, and clinical procedures, and even patient care. So for nursing and midwifery students, mastering anatomy enables accurate diagnosis, safe intervention, and effective patient care. So it's a must. You have to master it. You have to know the body structure. You have to know the relationship between those parts. You need to know understand how the body part is being organized, and you'll be able to know how to apply your clinical procedures, how to assess patients, and every other thing that is required for you as a nurse and as a midwife. Let's continue. So, like I said, I'm going to use the pelvic bone as our case study. Let's take, for instance, that you are studying reading anatomy, and the particular area we are reading is about the pelvic bone. So first you're going to start with the pelvic bone. We've known that the pelvis is a basin-shaped bony structure located at the lower trunk of the body, and it serves as a critical anatomical landmark in nursing and midwifery practice. And this pelvis is formed by the two hip bones, the innominate bone, one on each side, the sacrum, the triangular bone at the base of the spine, and then we have the coccyx, the tailbone at the bottom. So these bones articulate together to form a strong, stable ring that support the upper body and protect vital pelvic organs. Just like I said, I have the picture in my diagram, in my presentation, and you can see what I'm mentioning, that this pelvic bone is a basin shape. It's just like a basin. It's a basin structure. So as I'm seeing it, I'm really seeing what I'm reading. I'm not just just reading it, I'm also seeing it. And I can see the two hip bones which I mentioned, one on the east side, and I can see the sacrum, which is the triangular bone at the base of the spine. You can see what looks like a triangle at that base. Then you can also see the coccyx, the tailbone at the bottom, at the tailbone at the bottom. So that's just the definition, and you can also see the picture here, what I'm talking about. Let's continue. So what are the importance of, why is it important to study anatomy effectively? One is the foundation for clinical knowledge. Anatomy forms the cornerstone of all clinical understanding. It is heavily tested in nursing and midwifery exams, marking mastery essential for academic success. It's a strong anatomical foundation improve comprehension of disease, pathologies, and treatment approaches. So this is very important. For you to master your clinical knowledge, you have to study and understand the anatomy very well. And for you to do well in your nursing and midwifery exam, you need to know this anatomy. So secondary, why is it important to study anatomy effectively? Another one is for safe practice and decision making. Effective anatomy studies support safe nursing and midwifery practice by enabling practitioners to understand patient conditions accurately. It also aids clinical decision making, allowing healthcare professionals to assess, diagnose, and respond appropriately to patients' needs. So that's one of it again. It helps you to provide safe care for your patients. It helps you to make right decision concerning patients. Just take for instance, if you want to give medication, intramuscular medication to your patient, because you've known the anatomical position, you'll be able to know where to insert your syringe and give this IM medication to your patients. And it's not just that, it can also help you to assess the patient condition, diagnose, and also respond to each or patient's needs. Another importance of studying anatomy effectively is that it's essential for specialized procedures. Like when we talk about anatomical knowledge in obstetric, you find out that as a midwife, you have to know the anatomy of the pelvis for you to know the outlet and the inlet and know the presenting part of the baby, which is very important. And also, even as a nursing student, it also help you to understand about treatment when a patient comes with fracture, and you'll be able to know how to manage this patient. So understanding this pelvic anatomy specifically help midwife assess labor progress, identify complication, and even ensure safe delivery for both mother and baby too. Are you seeing that? So it's important both in the clinical area and for you as a student. So coming to the structure of this pelvic bone now. This section provides a detailed examination of the pelvic bone anatomy, essential knowledge for nursing and midwifery students. Now we are going to explore the components that forms the pelvis, including the hip bones, which we have the hip bone, we have the ilium, the ischium, and the pubis. Then we have the sacrum and coccyx. So understanding these structures is fundamental for clinical practice, particularly in obstetric care and patient assessment. So just from the picture I have here for the pelvic bone, you can see the hip bones, which we mentioned. We have the ilium, you can see the ilium, the two ilium, which is there both at the right and the left. We have the ischium. You can see the ischium, which is labeled to the ischium, and we have the pubis, which has the at the front. Then we have the sacrum at the back, which is the triangle part, and the coccyx, which is that toe, like a toe, just below the sacrum. So once you see this, your mind have already tell you this is the structure. This is the two ilium. This is the ischium, which is just uh, uh, behind, and then the pubis, which is at the front. Let's continue. Then what are the components of this pelvis? When we talk about the components, what are other parts, other structures connected to this pelvis? When we talk, then let's move over to the hip bone, the os causae. Under the hip bone, we have mentioned the ilium. This ilium now is the large upper flayed portion that forms the hip crest. You can see the ilium on from the diagram, which is the upper flayed portion. We have it at the two sides. Then after that, we have the word ischium. Ischium is the lower posterior part. The lower posterior part that bears weight when sitting down. You can see it at the lower posterior part there, which is the ischium. Then the pubis is the anterior portion that joins at the pubis symphysis. If you see the first diagram, which is up, you can see the pubic symphysis that joins the two pubics. I hope you can see that. That's what we call the pubics. They are being joined with the pubic symphysis. Then additionally, in the pelvic bone, we also have the sacrum, like we mentioned, the triangular bone at the base of the spine, formed by 5 fused vertebra, which is the sacrum. They are the triangular bone at the base of the spine that are formed by the 5 fused vertebra. Then we have the coccyx. The coccyx is the tailbone consisting of 3 to 5 fused vertebra below the sacrum. I hope you can see it from the pelvic bone diagram we have here in this picture. let's continue. Then moving over about that, after we've mentioned some of the parts, you also need to know the joints of this pelvic bone. That's one of the things you also need to know whenever you are studying anatomy and some of those bony structures. In the pelvis, we have some of the joints. One of them is the sacroiliac joint. This sacroiliac joint connects the sacrum to the ilium on each side. You've known the ilium now, and you've known the sacrum. So that thing that joins both of them is what we call the sacroiliac joint. This joint is very strong. It helps to bear the weight of this particular area, and it has limited mobility but allows slight movement during childbirth. So it's not always, you can't always move it like any other part of joint, but during childbirth it also have a slight movement. Another joint we have the pubic symphysis, like I mentioned earlier. This is a cartilaginous joint connecting the two pubic bones at the front of the pelvis. I hope you can see this pubic symphysis from my diagram here. So its joint is a cartilaginous joint connecting the two pubic bones at the front of the pelvis. It provides stability while allowing slight flexibility, especially important during pregnancy and delivery. Then after that, we have the sacrococcygeal joint. This joint now links the sacrum to the coccyx, the tailbone. This joint allows backward movement of the coccyx during childbirth to widen the pelvic arteries. So that's the joints we have in the pelvis. We have three joints: the sacroiliac joint, the pubic symphysis, and the sacrococcygeal joint. Because I've seen sometimes during examination, the OSCE exam, once it's vival time and you brought out the pelvis for students to identify and tell you what they know about the bone, you find out that they are not saying anything. They'll just mention the three bones in the pelvis and start thinking about it. But once you have this in your mind, we have the joint, we have those bones, mention those five bones and the joints, and you start talking about their function. You find out that you are talking more about it. Let's continue. Then we also have types of pelvis too. Types of pelvis. We have the gynecol pelvis. The shape is rounded. It has wide inlets. Under the clinical relevance is ideal female pelvis for childbirth, and it allows smooth fetal descent and delivery with minimal complications. This is the ideal one for childbirth. We also have the android pelvis. The shape is heart shape. It has a narrow inlet. What are the clinical relevance? It's more common in males. May cause obstructed labor in women due to restricted space for fetal health passes. So once you know this, you're talking about, if you're a midwife and they tell you to talk about pelvis, after mentioning those bony parts, the joints, you can mention the types of pelvis and talk about their clinical relevance, the ones that are the kind of pelvis that is needed during childbirth. The another one is the anthropoid pelvis. The shape is oval, elongated, and is anteroposteriorly. The clinical relevance we have is generally favors vaginal delivery. The elongated shape accommodates fetal health rotation during labor. Then we have the patopelvic pelvis. The shape is flat, wide transversely. What are the clinical relevance again? It's rare and problematic, difficult fetal health engagement due to shallow anteroposterior diameter and may require cesarean section. So these are the types of pelvis we have. Then moving over to the function of pelvis, you can see how I'm reading and I'm using this pelvic bone as a case study on how to study anatomy. So coming to the function of the pelvis, one, I have weight support. The pelvis support the weight of the upper body when sitting and standing. It also transfers the weight from the exoskeleton to the lower limbs, providing stability and balance for posture and movement. That's one. Then the second one is organ protection. The bony pelvis, like we know, forms a protective basin that shield vital pelvic organs, including the bladder, reproductive organs, uterus in females, and rectum from external trauma and injury. So it helps in protection of those organs at that lower parts of the body. Then we have the childbirth and movement, another function of the pelvis too. Here we have that the pelvis serves as the birth canal passageway during childbirth, guiding fetal descent. It also provides attachment points for muscles of the trunk, abdomen, and lower limbs, enabling what locomotions. So all these are the three major functions of what the pelvis: weight support, organ protection, childbirth, and movement. So when you're talking about it or writing about it, you see that the examiner will know that yes, you know this, and whenever you see it in the exam, you will know how to answer it very, very accurately. Thank you. So let's continue. Then, how effective steps to study anatomy? What are the steps that will help you to study anatomy? Because this is why I'm making this video, for you to understand how am I going to study this anatomy, how I'm going to read it and come out with distinction in my examination. So I want you to know that now we have explored the anatomy of the pelvic bone. So let us shift our focus to practical study strategies. So the following steps will help you learn anatomy more effectively, moving beyond the rote memorization to true understanding and what clinical application. So let's continue. One, the first step I want you to know is understand before memorizing. So one, focus on comprehension first, which is very important. Before attempting to memorize anatomical terms and structures, take time to understand what each structure does and how it relates to other parts of the body, which is very important. Blind memorization leads to quick forgetting, while understanding creates lasting knowledge that can be applied clinically. So first, before you start memorizing it, I want you to first understand the structure. How does it relate to other parts of the body? That's what you need to know first. Then after that, then relate the structure to functions through visual learning. So when studying the pelvis, don't just memorize the bone names like we mentioned some of those names. No, understand why the ilium is wide. Okay, why is this ilium wide? Why is wide? So why? Because it helps for muscle attachment. Are you getting that? You ask yourself, okay, why is the ischium strong? It's strong because it's for sitting and sitting what support. So once you know these things, whenever you are talking about you are being told to write short notes about pelvis or pelvic bone, you will know all these things. You'll be able to say it. And how this structure works together during childbirth, you can mention so this functional approach makes anatomy meaningful and what memorable. So every time you see pelvic bone, you've known, okay, this is why ilium is wide. Okay, this is why the ischium is strong, and this also help in childbirth. Then what is the second step again? Break the structures into parts. Example of breakdown is pelvis. Now pelvis, the simple parts we have is the ilium, ischium, pubis. So decompose complex anatomical structures into smaller, manageable units. This approach makes learning less overwhelming and helps you focus on understanding each component individually before seeing how they connect. It's very important. So try to break it into simpler structures, smaller units. It will help you to understand it more. Then the next one is use lists or diagram to separate parts visually. Create hierarchical outline showing how larger structure connect to smaller ones. This method transforms intimidating anatomy topic into achievable learning goals and improve long-term retention. So in this aspect, you can use diagram. You can know how, okay, I've known that the ilium is attached to the sacrum, and this is attached by sacroiliac joint. Just know the connections between them, because once you begin to know it that way, you'll be able to understand it very well, and it will assimilate more in your mind. Then the third step is use visual learning, which is very important. And what am I talking about the visual learning? One is that when you draw, when you see the pictures, you have a way of retaining it more in your brain, in your mind, and even in exam, you just imagine those pictures, and you can be able to picture it and know how to answer your question. So first, drawing anatomical diagram is one of the most effective ways to reinforce memory and deepen understanding. So when you sketch structures like the pelvis, you actively engage with the material rather than passively reading it. hope you are following and you are understanding this. If you have any question, please do well to send in your question to me, or you need one-on-one more coaching on this. Then, what are the key strategies for this visual learning? Draw and label the diagram repeatedly from your memory. Maybe you've seen the picture once, just close down your note or your textbook or the actual. Try and draw it from your memory. Once you draw it, repeat. Even if you make mistake, repeat it again. Do that again. Once you do it even more than 10 times, find out that it will be there in your mind and you will know how to draw it. Are you getting it? The another one is use anatomical model to understand the 3D relationship. So you can get the model. Uh, um, um, some schools have where they keep models, anatomical models. You can sign in and go and watch use those models for you to understand it again. Then watch educational videos showing structures in motions. You can watch videos where you see those structures and how it's being use is very important. Then create color coded diagram to distinguish components. Maybe after drawing you can just color them. Okay, this is ilium, this is ischium, this is pelvis, and this is sacrum and coccyx. It helps you to understand it very well. Then compare your drawing with textbook illustrations. So once you finish your drawing, you can now compare with the textbook and know where you are making mistake and where you are getting it. That's it. I want you to know that again, that visual learning transform abstract concept into concrete mental images that last. So once you use the visual learning to help you to understand it well, and you find out that you will not forget it again once even in your examination. So all these things are the things I want to tell you about how to study anatomy effectively and how to read it and prepare for your examinations. And another thing I also want to tell you is that if you have any question, please do well to send me your questions. And if you need one-on-one coaching on how to pass your exam, not just anatomy, even other subjects, or you need a person to help you help you to create a timetable and help you on how to read and understand, you can also reach out to me, and I'll be happy to help you. Thank you once again. My name is still Blessing, and I'm happy to make this video to you, and I hope it helps everyone. Thank you so much. See you again next time. Bye.